You're watching the award-winning GHS-TV, a nationally recognized student television station.
Hello, and thanks for tuning in to Medical Talk. I'm your host, Betty Lamar. Today, we're doing a series, about diabetes, and we cannot talk about diabetes without involving the kidneys, because if you're living with diabetes, you definitely need to take care of and know how to manage kidneys. So you know where we're going with this, right? We're talking chronic kidney disease. And I have with me one of the masters, Dr. Wesam Ballouk, nephrologist. I think I said that right. Hello, Dr. Ballouk, how are you?
How are you? Thank you for having me.
I'm well. And for those that need to know, we say the kidney doctor, okay?
That's correct.
Yes. Mm-hmm. So thank you again for joining me. You've been with me, I think this is our third time together.
That's correct.
But because you are the master,
appreciate it,
when
Betty.
I need to talk about the kidneys, I have to call Dr. Ballouk. So let's get started. For those that may not be familiar with you, just tell our viewers who Dr. Wesam Ballouk is, what you do, and where you do it.
All right. Thank you very much for having me, and thank you for this beautiful, very knowledgeable show, which give the people a lot of education. To start, my name is Wesam Ballouk. I'm a nephrologist, and who doesn't know what nephrologist is, they're specialized in kidney and the complication of kidneys like hypertension. And we go to, after medical school, you have to go to some like residency to specialize in kidney, and sometimes you specialize more like either transplant or hypertension. So to make it simple, it's a kidney doctors. Actually graduated from University of Tennessee here in Memphis, and then I did my residency here also, and then I joined the kidney group of Memphis. So I've been in Memphis almost 20 years practicing nephrologist. And actually we have multiple dialysis center, and one of them is home dialysis center all over Memphis.
Mm-hmm. Okay, so before we jump in, why the kidneys? What, I use the word, so what attracted you to want to study the kidneys and help people with their kidneys?
Okay, kidneys, they look small, but they are very effective. And
true.
I mean, thinking about it, God did an amazing job with creating the kidneys. Kidneys filter all the toxins.
Okay.
Whatever we eat, we take the good things, and we have to eliminate all the waste. So you need a very effective filtering system, and God created the kidneys.
Okay.
And this kidneys works constantly, 24 hours. While we're asleep, we're walking, we're doing everything. There are always a bunch of vessels and arteries and veins go there, and then the kidneys will filter what we don't need and keep what we need. And there's a lot of other functions for the kidneys. They produce hormone, they regulate the amount of the fluids we have, they regulate blood pressure, they even affect the bone and the vitamins, especially vitamin D, this control our bone structures. And a lot of other diseases can affect the kidneys, and that's make it very challenging while I'm studying. So I said I needed to learn about the kidneys because it's connected to multiple other systems. So if you are a nephrologist, you should know about diabetes, you should know about high blood pressure, you should know about heart, you should know about anemia. So that was challenging for me, and that's why I decided I need to challenge myself and go through this. So I like these specialties, and after practicing it, I loved it more.
Okay, so I remember growing up, that's what I love about Medical Talk, because the doctors like yourself, the masters, give me the tools that I need, because I believe in a healthy lifestyle. I try my best to be healthy. But so does food have any connection to the kidneys? just liquids? Because I think of kidneys, I think of liquids, like people say, don't drink a lot of drinks, but they never say anything about food.
Actually, yes. Everything we eat, they're all connected. So the type of food, it will affect the kidney in multiple different situations. Let's say we eat a salty food, that will be digested and all the sodium will be going to the blood, and the kidney has to get rid of this excessive salt.
Wow.
And this excessive salts will raise the blood pressure, make the body retain water, and then the kidney has to function harder, and the high blood pressure will affect the kidney more. The type of the food also, if you eat a lot of carbohydrate and end up with high blood sugar, this high blood sugar also is going to be eliminated by the kidney, and the kidney will suffer from that. If there's a lot of food also which is high in fat, will make the bodies overweight, and that will indirectly make people diabetic, and that will affect the kidney. So there is a lot of everything we eat and drink is all of it.
Like, ooh. Okay, so now we're going to say the kidney doctor. What would a kidney doctor not have on his dinner table this evening? So then that will pivot us to what is chronic kidney disease. What would you not have on your dinner table this evening?
All right, what I have personally different what I recommend, to be honest, okay? All right, it's very hard, but
okay.
I will say everything in moderation.
Okay.
So food which have a lot of salt, that's the first thing, is very important that we try to eliminate. And I tell my patient all the time, salt is not the salt shaker. Not everything is just, they will tell me, oh, I don't eat salt I don't eat salt. That means they don't add salt. But every food has salt. Bacon, sausages, ham, popcorn, the dressing, the ketchup.
Everything.
Everything has a lot of salt. I cannot eliminate all of this from my life.
Right.
But I will say in moderations.
Okay.
If you're gonna eat a pickles, that's full of salt. You know what I mean? If you're gonna, okay. The second thing, which is very important, carbohydrate. Also, you have to be watching the amount of the carbohydrate you eat, because that will turn in the body to a sugar, you know, and that will cause a lot of problem also in the long term.
Well, see, most people don't know what carbohydrates are. When I think of carbs, I think automatically, for whatever reason, breads.
Okay, carbohydrates comes a lot from starch. That will be the bread, potato, rice, and you know, all of that will, if give you example, the pasta, the pizza, the rice, the bread, and the potato. So all the good stuff.
Yeah, you took that right out of my mouth.
You know, unfortunately, there's a say, if it tastes good, spit it out. So I'm sorry. But
because it's not good for you.
But we cannot say that. So what we will say, all in moderations.
Okay.
You know, you're gonna eat. You have to enjoy your food too. So eat in moderation and increase your salads and healthy type of food.
Okay, now, CKD, chronic kidney disease. We're gonna get started now, and after we get a break, then we're gonna really dive into it. But just for right now, give us the basic of what is chronic kidney disease.
So as we talked, the kidney job is to filter the blood, and there are measurement how much is the kidney is filtering.
Okay.
The kidney should filter about 90 to 100 milliliter per minute per square body. So if it doesn't work this way, that means the function goes down and down. So diminish of the kidney functions over 3 months, consider chronic kidney disease. That's chronic. If it stays more than 3 months, we call it as a chronic kidney disease.
Okay.
And later on, we'll talk about what are the causes of it and how we prevent it and how we treat it if it happened. Some people also will have something called acute kidney injury, which is diminish of the kidney function, but is only for a short period of time, which can come back. The bad things, chronic kidney disease, they don't get better. They're gonna continue to get worse. And that's why we tell patients, you really need to find about it and check it. And if you have it, you have to take care of it so it will not progress, because will end up on causing the people to be on different type of dialysis if the function of the kidneys drop to like 15%.
Okay. Well, is chronic kidney disease initially, is it a silent disease? Because, I mean, how do you know if your kidneys are going in the wrong direction in the first place?
Very important question, because it's a very silent disease. People will end up losing 70 and sometimes 80% of their kidney function, and they have not felt anything.
Wow.
So that's why I have seen patients who is coming to me with a kidney function of 15%, and they will say, oh, I've been going to the bathroom all the time. I'm making a lot of urine. I have no problem. And I will tell them, you're going to end up on dialysis.
Oh, God.
And this is a very sad story, because if they have taken care of themselves, if they have checked on it and do the appropriate testings, we could find it. But I cannot tell you that, oh, you're going to feel this and feel this, that means you have kidney disease. There are some symptoms, but a lot of people will not have any symptoms until their kidney has significant damage before they even find out about it.
Okay. So does primary care doctors, as a rule, like me, I'm a veteran, so I do all my annual checkups, and they always do blood and all that. So they're looking at what your kidney functions. Is that a part of your annual exam when you?
Okay. So this is very important.
Okay.
Anybody, they have to have a primary care and maybe a yearly checkup.
Yes.
Let's start with that. But the yearly checkup is very important, where they will monitor the blood pressure, and they will check the urine, and they will do a blood test. Okay. And all of that will give us an indication that you do have a chronic kidney disease and catch it way early before it's progressed.
Okay.
So the primary care, who will do the appropriate initial physical exam and blood testing and urine testing, and that will give them an idea that there are some disease and you need to follow up with that.
Okay. Well, before we go to break here, I have to share this with you so I won't forget. I remember one year I did all my annual, they did all the blood, and I was trying to read my own numbers and had a panic attack because I was looking at my kidney functions, and the number I thought meant that I was in trouble, and they had to literally call me in to calm me down to convince me that my kidneys were fine. I just didn't know what those percentages meant.
Yeah.
So anyway, we'll be right back with more medical talk. And my very special guest today is Dr. Wesam Ballouk, and we're talking about chronic kidney disease. Watch this space.
You're watching the award-winning GHS-TV, a nationally recognized student television station.
Welcome back to Medical Talk. I'm your host, Betty Lamar. I am having a wonderful conversation today, and we're talking about chronic kidney disease. And you do need to watch this space because, as my guest, the master, Dr. Wesam Ballouk, just said a minute ago, kidney disease is silent. You can be walking around feeling like everything is all good, and it may not be. So we're going to jump back in, and we're going to talk about some of the causes, what we can do maybe to prevent it, okay? So Dr. Ballouk, I am so excited about this conversation, and I thank you so much because I learned so much when you're with me. So let's jump in. We're talking about chronic kidney disease. So let's jump in, like tell us about everything we need to know, the causes, and just go. I just want to sit back and I want to learn something.
Again, thank you for having me. This is a very, very important topic because chronic kidney disease is very prevalent, and a lot of people in the United States, and especially in Memphis, we have it, and they don't even know about it. So it is very educational for the general public to know what people who have risk of having chronic kidney disease and how they find out about it, because they will not feel anything. Even if they make a lot of urine, even if they are drinking plenty of water, they could be running with a chronic kidney disease, and it's a silent disease. So the first things I'll tell you who are the people who's at higher risk.
Yes.
And the people who is overweight, the people who had significant family history of high blood pressure. There are certain also African American and Spanish have a higher risk of having chronic kidney disease because they have higher risk of having high blood pressure and diabetes. So people who have family history of kidney disease, which a lot of people here, they have this. So they are at higher risk. And so they cannot just have any symptom and say, oh, I have a kidney, because chronic kidney disease doesn't even hurt. They will not have pain. They could make urine like other people. So the first and the most important things to have a primary care, and the primary care will do a physical exam, make sure their blood pressure under control. We do a blood test, and the blood test will check something called creatinine, and BUN, and potassium and electrolyte. So that will tell us an indication that if the creatinine is up, that means the filtering part of the kidney is not working as should be. And also we check the urine and make sure they're normal urine, they're not leaking protein, or there's something else is going on, or there's blood or something, which will give us an indication that they have some kidney problem. So the primary care will decide and do the second step, which is appropriate testing. And if you feel that they have some kidney issue, then they will refer them to us. We are as a specialist for chronic kidney disease and dialysis. We will come and see the patient and evaluate and give them the appropriate diagnosis and take care of their chronic kidney disease, and hopefully we'll slow it down. Again, there's no easy treatment for it. Like it's not like a headache. You give some Tylenol, it's gonna get better. You know, and this is called chronic. Okay. And now, let's talk a little bit about what the causes of chronic kidney disease. Okay. If you want to remember, two important things will be high blood pressure and diabetes, and they're very prevalent, as you know here, and that's why diabetes very connected to chronic kidney disease and dialysis. If you look, all the people, almost 80% of the patients on dialysis right now, they were diabetic and hypertensive before. So I recommend and I advise people, if you don't want to be on dialysis in the future, start taking care of yourself right now, especially when you're young. So high blood pressure, it's very prevalent, especially if they have high blood pressure in their family, mother, father, sisters, siblings. If you have it, you need to go and check your blood pressure with the primary care. The goal for the blood pressure is 120/80. Okay, so when you start going up to 130, that means there's an indication that you have some elevated blood pressure, and you need to start taking care of it and control the blood pressure. Blood pressure when it's high, that means that the blood is kind of pushing on the kidney and causing the arteries to be stiffer and stiffer over many years. So that will damage the kidney and make the kidney function goes down gradually. And we're not talking about a day or two. We're talking about a long term. It's like punching the wall. That's constantly, gradually.
You say start early, taking care of yourself.
That's correct. Early means everybody should, above 20 years old, should start getting checked. Okay. So the primary care, we check the blood pressure, and if it's high, we start treatment to control the blood pressure. And there's multiple medication, and also we put them on certain diet, like low salt, certain food that will raise the blood pressure. We tell the patients to exercise, lose weight all the time, eat healthy. Okay, so this is, we talked about covered hypertension, very important. And some people will require 3-4 medication to control blood pressure because they're, because the vessels are very stiff. Okay. Now we go to diabetes. Also diabetes, very prevalent, as you know. A lot of people have diabetes. So that's why we'd like to work together with diabetic doctors, endocrinologists, so they refer the patients in the very early stages, okay? Because the first indication that they start damaging the kidney, they start leaking protein.
Oh.
Glucose goes and bind with the efferent vessels, which is the arteries and the veins, and
Yes.
they start having problem causing the kidney leaking protein. And after you start leaking protein, the function of the kidney diminish gradually. And after many years, especially if the blood sugar not controlled, you lose a significant amount of kidney functions. And unfortunately, people may end up on dialysis. So we want to intervene way early, because with controlling the blood sugar, with getting the hemoglobin A1C under control, and there are actually newer medications, which we can give to slow down the progressions of diabetic nephropathy. This is what we call it, diabetic nephropathy.
Okay.
Damaged kidney from the diabetes, okay? And we also work together with the endocrinologist to modify their lifestyles, get them on the right medication, to control the blood sugar and slow down the progressions of the diabetes damaging the kidney.
Is it inevitable, if you're a diabetic, that you're going to end up seeing a Dr. Wesam Ballouk?
Actually, you will end up having some kidney disease, but it's not inevitable that they're going to end up on dialysis.
Oh, okay. Oh, okay.
Okay? If somebody had a diabetes for 20 years, I'm sure I will have some leaking protein. But
Okay.
if it's not controlled, you could die from something else before you even end up on dialysis.
Yeah, you never
You
know.
know, and you never know. So,
Okay. All right.
but if they don't take care of themselves, maybe 5, 6 years, 10 years, they're
Yes.
seeing themselves on dialysis, and that's our goal. I keep telling my patients, don't be scared. Come and take care of yourself, because we don't want you to be losing all your kidney functions.
No.
We
Yeah,
wanna
I'm just
see
sitting
you
here now
early.
like, this is very important. We don't think about those kidneys. We just really don't. But like you said, if you lose function, and once they're damaged, chronic, then that's
they're
when
gonna
you
go back.
realize how important the kidneys are. They're just not hanging around in there,
So if it's for sure chronic, honestly, we work on slow it down. We cannot work on improving it much.
Wow.
So the third important thing's medication.
Okay.
And we have very common medicine, people use it right and left over the counter, is the NSAIDs. NSAIDs, it's ibuprofen, Aleve, Advil, wonderful drugs for pain.
Yes.
But they're very bad on other organs like stomach and kidneys. So if somebody is taking it on a regular basis, they start damaging the kidney and cause diminish of their kidney functions and can cause a lot of other things. So be careful. Taking medication on your own on a regular basis without consulting with your doctors, it's harmful, and harmful to the kidney especially. We have other things can damage the kidney, autoimmune disease like lupus, and we see it over here too. It's the body's immune system will start attacking the kidney, and that's also need to be monitored and treated. We have genetic causes, people who have a lot of cysts, we call it polycystic kidney disease.
Wow.
If there comes from the family, if the family member end up on dialysis in the young ages, they need also to be checked in the primary care and find out, do you have any genetic disease which causing kidney to fail? But if you want to remember two things, diabetes and high blood pressure is very critical.
Okay. Now, you got to jump into, explain to me how, because we want to get this in before the show ends as well. Explain the process of dialysis, and I guess, does a person, once you start dialysis, do you get off of it, or is it a forever thing?
Okay. Before I go to dialysis, I want to tell what we do as a nephrologist
Okay.
to prevent dialysis.
Okay.
Okay, our goal is not to make people on dialysis.
Okay.
We actually feel disappointed that our patients end up on dialysis because, we see them late or
Okay.
he didn't take care of himself, he didn't show up. Okay. So we want them to control their blood pressure, control the diabetes, put them on appropriate medicine so they will not end up on dialysis.
Okay.
But as the ultimate final result, if we have no choice, then we have dialysis. Dialysis, they are usually two type, where they come to us in the center, we take the blood, clean it, and put it back.
Okay.
If it's chronic and the kidney is completely gone, they will not get over it unless we send them for transplant. Okay? And we have also, home dialysis, and we have a great center actually here in Memphis, and multiple centers for doing home dialysis will make it easy. But we work together and we try to work early so we can get them a transplant so they will get off dialysis.
Okay.
Okay?
All right. Now, I hate to do this, but they're telling me we're going to have to go. But I don't want to leave without, number one, just saying thank you for giving us the tools that we need. Now it's up to us to take care of ourselves. But take this, these last few seconds to, again, tell our viewers who you are, where you practice, where they can find, hopefully they won't need you, but
Yeah, hopefully
we
they
don't
will
have
not need us.
any symptoms, so we don't know.
But my name is Wesam Ballouk again.
Okay.
I'm a nephrologist here in Memphis. We have multiple locations, Bartlett and Midtown and Germantown and North. We are as a group, but I'm practicing mainly in Bartlett and Midtown. And we have Fresenius dialysis centers all over Memphis area.
Thank you so much. You have my antennas up for sure. And I mean, you are definitely one of the masters.
Thank you very much, and thank you for having me, and thank you for this show, and it's very educational, and I hope everybody will take care of their body and see a primary care, and hopefully they will not need me.
That's
Okay?
right. But if you need him, he is the master.
Thank you.
I would like to thank you so much for watching Medical Talk today. Chronic kidney disease. Take care of yourself. What I do is bring the doctors in, the top doctors, so they can give you, as I always say, the tools that you need to make healthy lifestyle choices. Because without your health, I mean, like, what do you have? So we want you to have good health. And do see your primary care doctor. Make sure your kidneys are in good working order, because you don't want to have to go to Dr. Wesam Ballouk because you haven't taken care of yourself. Again, tune in Friday nights at 9:30 p.m. on Comcast Cable Channel 17. You can check us out on GHS-TV YouTube channel, Betty Lamar Memphis on YouTube. Again, thank you for watching this space, and we hope to see you again soon.